We are here with Dr. Madan Kandula, and we are discussing CPAP machines. Believed by some to be the gold standard or really only solution to snoring issues and sleep apnea, these machines only have varying degrees of success. Isn't that correct, Dr. Kandula?
Yeah, that's true. So, unfortunately, CPAP is a good option for a lot of folks, but, unfortunately there's a lot of confusion about that option and a lot of misunderstanding. And I think I always blame the medical practitioners like myself, who perpetuate that. So a lot of folks are set up with this technology, which is a good technology, but aren't explained on how to use it or why it's there or what other options there are for them. And they end up frustrated, and that lack of knowledge doesn't help anybody.
Great, great. We've had a few people submit questions via email over the last week or so. So let's take one from Jill H. My husband complains about my snoring. Won't a CPAP machine take care of that?
Possibly, so it's sort of putting a little bit the cart before the horse on this. So sleep apnea is one issue that can happen when somebody's sleeping at night, and for those that don't know, sort of the ins and outs of that, it's when somebody stops breathing while they're sleeping at night. Snoring is when, basically you're breathing, but the back of your throat is vibrating. So everybody who has sleep apnea pretty much snores. Most folks who snore don't have sleep apnea, so the first starting point is, well, which one is it? And sometimes it's obvious that somebody's stopping breathing at night. Most of the time it's not obvious. So if somebody's snoring, that's not a good sign. And sometimes you can get fooled into kind of complacency. Well, it's snoring, it's annoying, I'll just put my earplugs in or go to the next room. But that's the first sign that, okay, something's not right. And so to figure that out, first step for us is to listen, see what's going on, and then the simplest way to figure this out between whether somebody's snoring or has sleep apnea is to do a home sleep study, which is a simple thing to do. At home, in your own bed, just a device that goes on and lets us know whether somebody's snoring and to what extent, and whether that same person has sleep apnea and to what extent. Based off of all that information, based off of somebody's, anatomy, so what they look like, both in their nose and their throat, and based on sort of their wishes and wants, then we determine, okay, what's an option? So CPAP may very well be a good option for that person. It may be overkill. It may be, sort of not the best option for them. Sometimes folks have anatomy issues where surgery might be a better option than CPAP, or other folks have claustrophobia issues, and then for those situations, a dental appliance may be a better option than CPAP. Most folks who have sleep apnea have nasal issues, and so that's one of our sort of fundamentals is we're going to at least look at that and check that out, make sure that the nasal breathing passageways are open before we move on to any treatment options.
Great. I think this is a good time to chime in with a second question. This one is from Alice R. I don't think my sleep apnea machine has helped at all. What else can I do? You kind of touched on a couple of those
Some of the things I was just talking about. So, it depends. I mean, so the question there is, well, why hasn't it helped? Is it something that you're using consistently, or are you not? If you're not using it, that's okay. I mean, as long as we know that. And if you're not using it, well, why aren't you using it? And like I said, some folks have claustrophobia issues where anything on their face, they just feel comfortable enough to fall asleep. So other folks will use it, but find themselves taking it off without them knowing about it in the middle of the night. If somebody's using a CPAP machine and comfortably using it throughout the night and still doesn't feel the benefit of it, then there might be something else going on, and so that can happen. But the most common issue there, for most folks who have sleep apnea, try a CPAP, don't find that it's effective for them. Number 1 through 10 on the list of reasons why that's probably the case is usually because somebody's nose isn't working properly. And so with a CPAP machine, the best route for a CPAP machine is through a nose that's open. If somebody doesn't have a nose that's open, then the next best route is to put a full face mask on. But that's a big jump, going from a nasal mask to a full face mask, and most folks don't like that jump necessarily. And so for us, it's sort of taking a time out, see what's going on. If we do have nasal issues, let's get those guys fixed, and then see how things go. And for some folks, CPAP isn't there. With the CPAPs, it's evolved over time. Machines are pretty quiet nowadays. It's like a low fan in the room, pretty small. So all that's pretty has come a long way over the last decade or so. But for some folks, they just like I was saying, it just isn't necessarily one size fits all for that, and some folks just aren't able to find comfort in their sleep when they've got something on their face.
Excellent. We had another question come in. This is more of a lifestyle inquiry. Are there any lifestyle choices you can make to help prevent sleep apnea?
Well, I mean, there's certain things. So lifestyle choices could, if you have sleep apnea, lifestyle choices don't get rid of that sleep apnea. But if somebody snores or somebody has sleep apnea and you have a couple of drinks, before you go to bed at night, drinking alcohol is a sedative, and so it sort of relaxes the muscles in the back of your throat. So if you snore, you're going to snore much more loudly. If you have sleep apnea, you're probably going to be doing more pauses when you're sleeping at night. The one lifestyle choice that can come into play is, and this is not always the case, but for somebody who has sleep apnea and has extra weight on, that weight isn't helping and likely is hurting the cause. And so lifestyle choices to identify that as an issue and maybe try to reverse that situation is a nice thing. It's hard to do. So if somebody's got extra weight on and somebody has sleep apnea because of that weight, it's almost impossible to lose that weight unless we treat the sleep apnea. So it's a pretty simple concept. So that's really, for me, I haven't really seen anybody be successful in doing that. I'm sure they exist, but I haven't seen it with my own eyes. And so for us here, it's really trying to figure out, if weight's an issue, that's okay. I mean, so we understand that it's not an uncommon thing. If the sleep apnea is there, then let's treat that sleep apnea, try to figure out the best option for that individual, and then let's move on towards that weight loss. And it's as you would imagine, it's easier to make some of those lifestyle choices when you're well rested versus the opposite.
Excellent. As we wait for our live viewers to offer in a question, we have another one that came in. This one was from Bruce W. He asked, why is sleep apnea bad for you? And I think he's trying to get at what type of medical conditions can sleep apnea lead to.
Yeah, I mean, it's bad in a lot of different ways. I mean, so the initial badness is that people, and every animal sleeps for a reason. So your sleep is the time of day or night that your body's trying to recover. So if somebody has sleep apnea, they're never, ever, ever getting a full night's sleep unless we treat the sleep apnea. And your body can deal with that for one night. You can pull an all-nighter, but if you're doing that night after night after night, that's really hard on your system, hard on your mind. Makes it hard to go through your day-to-day functions properly. If somebody has sleep apnea that's not treated, one of the highest risks that are out there is getting behind the wheel and driving. So you're more impaired. If somebody has sleep, this is sort of, it's the truth, but it's sort of not very well recognized. You're more in danger if you get behind the wheels and you have sleep apnea that's not treated than you are if you have depends how many drinks you have, but and it's not a apples to apples comparison, but that's why it's taken so seriously. That's why nowadays, if you have a commercial trucking or driver's license, they're going to be asking about sleep apnea. But I think for folks who aren't in those situations, I don't know that that's as well understood. But those are really big factors. And then back to the impact of sleep apnea on each individual. Those struggles. So when you're sleeping at night, when you have sleep apnea, it's like someone's coming in and strangling you. Every time that happens, your heart rate elevates, your lungs are trying to fill with air and they're not getting that, and so that builds up tension behind the scenes. So if somebody has sleep apnea and it's not treated, then your risks of heart attacks and strokes it depends, but the starting point is about 6 to 8 times the risk of somebody who doesn't have sleep apnea, and those numbers go up and up and up. And so as the more struggle that somebody has when they're sleeping at night, the more likely they are to have other issues. Heart attacks, strokes are one side of things. There's a very high correlation between sleep apnea and diabetes. On and on and on. There's actually we have good data nowadays that show a high correlation between sleep apnea and erectile dysfunction, and you can go down that list. Now, when you look at this scientifically, it's sort of, is it causative? Is it just circumstantial that everything comes together? And sometimes things are circumstantial, but this particular issue is sort of, it's something that gets its tentacles into a lot, it gets its tentacles into a lot of other areas, and I would say it's absolutely causative for a lot of these things.
Great. Yeah, it's clear that that's just, it's more than just losing out on a few hours of sleep here and there.
Absolutely.
We just got a question in from Joe. Are there any commonly prescribed medications that make the symptoms of sleep apnea worse?
Yeah, I mean, the most commonly prescribed medications would be that would hinder or hurt your sleep apnea situation would be sedatives. So if somebody takes, well, for instance, this is this perfect storm for a lot of folks is you have sleep apnea, you may not know it. Your body knows it when you go to sleep. It knows that when you go to sleep, your body struggles and it's going through kind of a torture session. So what does your brain figure out? It says, boy, I don't really like going to sleep. I know I'm tired, but I don't want to go to sleep because I'm going to be getting choked, 20, 30, 40 times an hour, and that doesn't sound fun. So the alternative is let's just try to stay awake even though we're tired. And so what's the sort of next thing that's done is, well, let's give you a sleeping pill, let's give you a sedative. Maybe that'll, kind of ease you to sleep. So now you've got somebody who has sleep apnea, already has a tight airway. Now we're sedating you, so makes your body relax more, very similar to alcohol, and that helps to create that perpetuate that situation, on and on. So it's sort of a lot of folks will chase things. They'll chase caffeine during the day. I mean, it's not a sort of a prescription medication, obviously, but there are things that your body will sort of look to do to try to circumvent what's going on. And the hard part, unless you know what's going on, the choices that your body makes aren't necessarily helpful from a medication standpoint. Like I said, mainly the sedatives will be the biggest ones that have an impact as far as sleep apnea and snoring goes.
Excellent. Good question. Okay, I think those are all the questions that we have today. Thank you to Dr. Kandula and for all of you for taking part in this informative discussion.